Welcome to the deep dive. I'm really glad you're here with us today because we are exploring something that honestly blew my mind a little bit.
Yeah, it's a tough topic, but a really important one.
Right. So imagine doing everything perfectly. Like you encounter a legitimate medical issue. Maybe it's panic attacks that literally leave you gasping for air or, insomnia that's so severe you feel like you're losing your grip on reality.
Which is terrifying for anyone.
Exactly. So
Mm.
you do the responsible thing. You go to a doctor, right, and they write you a prescription. You follow the dosage instructions to the absolute letter. You only take the medication exactly when directed.
You're following the rules.
Yeah, completely. And yet, somehow, months later, you wake up to this terrifying realization. You are completely physically dependent on this drug, and your original anxiety is somehow actually worse than when you started.
Yeah. And that paradox, it is one of the most disorienting experiences a patient can go through.
I can only imagine. It's like walking into a maze backward.
Yeah.
You follow the instructions perfectly, but suddenly you're totally lost and you need a specialized map just to get out.
That's a great way to put it, because today we are looking at a condition formerly known as sedative, hypnotic, or anxiolytic use disorder. And we're going to explore the holistic recovery options available, specifically looking at a telehealth practice in Georgia called Coping and Healing Counseling, or CHC.
Right.
But before we get into the mechanics of all this, I do want to clarify the medical terminology. So sedatives and hypnotics, those are your prescription sleep aids.
Yeah.
And anxiolytics, those refer to anti-anxiety medications. Basically, drugs designed to literally dissolve anxiety. We're talking about household names here.
Like Xanax and stuff?
Exactly. Xanax, Ativan, Klonopin. And I want to be super clear. These are medications that genuinely help people. They serve a critical medical purpose.
Right. We aren't demonizing the meds.
Not at all. But our mission today is to deconstruct how this dependency can form entirely by accident. And, we have to note right up front that diagnosis is made by a licensed clinician. That's a crucial detail.
Okay, let's unpack this because it feels really necessary to challenge the cultural baggage we have around the phrase use disorder.
Oh, absolutely.
Because, society conditions us to associate that term with, like, reckless behavior,
Right.
or recreational misuse, rule breaking. So how does a dependency form when someone is literally following the rules to the letter?
Well, what's fascinating here is the physiological reality of it all. The human body is just this fiercely adaptive system. It really doesn't factor in your moral character or your intention.
It's just biology.
Right. When you introduce a powerful chemical that forces the central nervous system to calm down, the brain notices. And over time, it recognizes, hey, this external chemical is doing all the heavy lifting.
Oh, wow. So it gets lazy.
Basically, yeah. To maintain efficiency, the brain actually downregulates its own natural calming mechanism.
Wait, really?
Yeah. It essentially stops producing or utilizing its own internal soothing chemicals at normal levels simply because the medication is doing the job for it.
So the brain is just trying to adapt to its new chemical environment. It's like outsourcing the labor.
Precisely, it outsources the labor, and that's why understanding the biology here strips away the stigma. There is zero shame in this, none.
Right.
The body just did exactly what bodies are programmed to do. It adapted.
And because it happens as this natural biological process, I guess the warning signs are almost entirely invisible to the outside world.
Completely invisible. Nobody sees you losing control.
Yeah, the symptoms are just this silent, internalized creep. Like one of the first indicators the text mentions is simply a shifting baseline. Like the dose that used to give you, say, 8 hours of profound relief. Suddenly, it only takes the edge off for 4 hours. You just need more of the chemical to reach that exact same level of calm.
And that phenomenon, medically, is known as tolerance. And tolerance ushers in a secondary, much more distressing symptom, which is interdose withdrawal.
Interdose withdrawal, meaning between the doses.
Exactly. The periods between your scheduled pills become increasingly difficult to navigate. You start experiencing these wild surges of anxiety that seem to just come out of nowhere, usually peaking right before your next dose is due.
Here's where it gets really interesting. Because let's visualize how that interdose anxiety actually operates. Because it's not just a return to your normal stress level.
No, it's much worse.
Right. So think of the medication as this heavy concrete dam built across a river. And the river is your underlying anxiety. So you take the pill, the dam drops into place, and it holds the water back.
It feels peaceful.
Exactly. Everything downstream is totally manageable, but the river didn't dry up.
No, it didn't.
The anxiety is just pooling behind that barrier, building up immense pressure. And as the medication metabolizes and wears off, that dam starts to crack.
And the water doesn't just resume its natural flow, it bursts through those cracks with all the accumulated pressure of being restrained.
Which is terrifying. So the anxiety you feel while waiting for your next pill can actually be far more violent than the original anxiety that sent you to the doctor in the first place.
Exactly.
Because you're dealing with the initial stress plus the rebound effect of this dam breaking.
Which forces a profound psychological shift. You know, initially, the medication was just a background tool, like something you kept in your pocket.
Just in case.
Right, but as the interdose anxiety gets worse, you start quietly building your day around the next dose.
Oh, man. The medication stops being a tool and becomes like the central organizing principle of your whole life.
Exactly.
You find yourself at a work meeting, just doing mental math, looking at the clock like, when can I take the next pill so the dam doesn't break?
Yes. Or avoiding travel, or declining social invites because you're terrified of being away from the prescription.
And because you're still taking it as prescribed, you might literally be the only person who knows how captive you've become.
And that realization is usually the turning point. You realize the substance that was supposed to give you freedom is now dictating your every move.
Right.
And the natural instinct in that moment, the human instinct, is to just reclaim control. You want to march into the bathroom, dump the pills in the trash, and just endure the discomfort to get it out of your system.
The cold turkey approach.
Exactly.
But wait, if the listener realizes the pill is the problem, why is the solution to keep taking it? Isn't the slow taper just, I don't know, prolonging the issue?
If we connect this to the bigger picture, remember how the brain outsourced its calming mechanisms?
Right, it stopped making its own soothing chemicals.
Exactly. So if you suddenly remove the medication, your central nervous system has zero structural defense left.
Oh, wow.
It is abruptly plunged into a state of massive hyperexcitability. And we are not just talking about feeling jittery.
What happened?
Severe withdrawal from these medications carries a very real risk of life-threatening seizures.
Wait, seizures? So the very act of trying to free yourself could put you in the emergency room?
Yes. The explicit warning from the clinical guide is do not stop suddenly. The brain needs a highly controlled runway to land safely. You can't just cut the engines mid-flight.
That makes sense.
So the only safe road is a slow taper that is strictly supervised by a prescriber. They lower the dose in microscopic increments, which gently coaxes the brain's natural calming systems to wake back up.
Okay, so what does this all mean? The prescriber slowly dials back the medication, but as they do that, a massive void opens up, right?
Yes, the original anxiety is still there.
Right. So if we think of the medication as like temporary construction scaffolding holding up a fragile building,
Yeah.
the medical taper is the crew carefully dismantling that scaffolding.
Right.
But if there's no internal support structure built inside the building, the second the scaffolding is gone, the building collapses.
Which brings us to therapy. This is where we bridge the medical taper to the psychological recovery. Therapy rebuilds what the pill was carrying.
It's the actual architectural reinforcement.
Exactly. And the text highlights two specific approaches here, CBT and CBTI.
Let's break those down.
Yeah.
CBT is cognitive behavioral therapy, right?
Correct. And that is specifically used to treat the underlying anxiety during your waking hours. It's not just venting to a therapist. It actively trains your brain to intercept catastrophic thoughts and reroute your physiological response before you spiral.
So it teaches your brain to do the work the pill was artificially doing.
Exactly. And then you have CBTI, where the I stands for insomnia.
Okay.
Because sleep disturbance is a massive driver for these prescriptions. People are terrified of their own beds. CBTI fundamentally repairs your behavioral relationship with sleep without using medication.
That's amazing. So it's a 24-hour holistic recovery net.
Yeah.
CBT for the day, CBTI for the night.
Yes.
And the ultimate goal is leaving with coping skills that no prescription can possibly give you.
Right, because a behavioral skill doesn't wear off. It doesn't cause interdose anxiety.
But, knowing exactly what kind of therapy you need is kind of useless if you can't access it.
That is the logistics nightmare for so many people.
Especially in Georgia. It's geographically massive. You have a few dense cities, but mostly it's highly rural counties.
Right.
Driving 2 hours each way for this highly specialized two-pronged therapy just isn't feasible for most people.
This raises an important question. How do we remove those barriers? And that's where coping and healing counseling, or CHC, comes in.
We'll talk about them.
They've completely re-engineered the delivery model. They serve all 159 Georgia counties via a 100% telehealth IPA compliant
All
model.
159 counties. That's huge. And I have to ask, Does removing the physical waiting room and doing everything via telehealth, does that fundamentally change who is willing to seek out this kind of deeply personal help?
Oh, absolutely. Think about the shame we discussed earlier. The dread of walking into a clinic, sitting under fluorescent lights, wondering who is judging you.
Yeah, that alone stops people.
Exactly. Telehealth dismantles that. You do the work from the safety of your own living room. And CHC has a team of over 15 licensed therapists, LCSWs, LPCs, LMFTs.
Real credentialed professionals.
Yes. And crucially, they're diverse and culturally competent.
Which is so important. You shouldn't have to spend half your session explaining your cultural background or family dynamics to someone who just doesn't get it.
Right. When you combine that cultural competency with the removal of geographic barriers, it's a game changer. They offer individual, couples, family, and teen therapy for ages 13 and up. Specialties include trauma, PTSD, grief, relationships.
They cover it all.
They really do.
But we have to talk about the financial barrier, because none of this matters if it bankrupts you.
Well, this is the most disruptive part of the CHC model. For patients on Medicaid, the copay is $0.
Wait, zero?
Zero.
So highly specialized CBT delivered to your living room anywhere in Georgia for $0.
It completely eliminates the traditional financial hurdle. And for major commercial insurances, they take Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, Humana. The copay ranges from just $0 to $40 a session.
That is incredible. It totally levels the playing field.
It really does.
Okay, to wrap this up, let's just recap what we've covered. We've looked at the accidental nature of prescription dependency, how things like Xanax or sleep aids can trap you even when you follow the rules.
Yep.
We recognize those quiet, creeping symptoms, like the interdose anxiety. We established the absolute medical necessity of a supervised taper, do not quit cold turkey. And we saw how accessible telehealth therapy like CHC can help you build lifelong coping skills.
It's a full roadmap back to wellness.
And to you, listening right now, if you see yourself in these symptoms, if you're quietly organizing your day around a pill, please remember, there is zero shame in this. Your body just adapted.
That's right.
And you have access to help tonight. You can reach Coping and Healing Counseling at 2gtherapy.com. You can email them at support@2gtherapy.com, or you can call them directly at 404-832-0102. You don't have to do this alone.
Absolutely. And, I just want to leave you with a final thought to mull over. The text explicitly states that therapy leaves you with coping skills no prescription can give. And if a chemical can only ever temporarily carry a burden for you, it kind of forces you to wonder, how often do we mistakenly outsource our own agency to a quick fix?
Oh, wow.
And how might the really hard work of rebuilding our internal coping skills change not just our anxiety, but our entire capacity to navigate life's inevitable stressors?
That is such a powerful question. It changes everything. You're not just surviving, you're rebuilding.
Yeah.
Well, thank you all for joining us on this deep dive. Take care of yourselves out there.